Healthcare professionals should do the primary assessment initially for aware patients who may require more sophisticated assessment and management techniques. A. True. B. False. Rescue breaths should be given at a rate of 1 breath every seconds to patients who are having respiratory arrest with a perfusing rhythm. A. 6 seconds. B. 5 to 6 seconds. Which of the subsequent procedures takes place prior to the BLS assessment? A. Activate EMS and, if available, procure an AED. B. Are you okay? Ask the victim as you tap them on the shoulder. C. Ensure the safety of the scene. D. All of the above. Which of the following statements about CPR once an advanced airway has been established is true? A. Chest compressions should be stopped while giving breaths. B. 1 breath every 6 seconds should be given. C. The breaths should be synchronized with the chest compressions. Which statement regarding the oropharyngeal airway is false? A. Throughout bag mask ventilation, the OPA maintains the airway open. B. The OPA can make you gag and cough. C. On a patient who is aware, the OPA should only be applied. Suctioning attempts in ACLS scenarios should typically be A. 5 seconds or less. B. 10 seconds or less. C. 20 seconds or less. For adult resuscitation, the most crucial algorithm to understand is A. P. B. Cardiac arrest. C. Bradycardia. D. Tachycardia. Which of the following describes the proper order for BLS CPR? A. Airway, breathing, circulation. B. Chest compressions, airway, breathing. C. Circulation, airway, breathing. D. Access care early, begin CPR, check pulse. All of the following, with the exception of, are instances of advanced airway adjuncts. A. Laryngeal tube. B. Laryngeal mask airway. C. Oropharyngeal airway. D. Combi tube. The following questions should be made during the primary assessment's airway assessment section. A. Is the airway patent? B. Is an advanced airway indicated? C. Does the patient have a pulse? D. Both 1 and 2. The compression to ventilation ratio during CPR when there is no advanced airway in place is A. 10:1. B. 20:2. C. 30:2. D. 5:1. After using an AED to shock someone, you should A. Check a pulse. B. Let the AED reanalyze the rhythm. C. Start CPR, beginning with chest compressions. D. Give a rescue breath. The bradycardia algorithm's main decision point is the determination of A. Rhythm, B. Heart rate, C. Adequate perfusion, D. Blood pressure. The recommended current milliamperes output for transcutaneous pacing is A. Set 2 milliamperes above capture dose. B. Set at 30 milliamperes. C. Set 4 milliamperes above capture dose. D. Set no higher than capture dose. You should check the carotid pulse after starting external pacing to ensure mechanical capture. A. True. B. False. What would you do if transcutaneous pacing and medication don't work? A. Defibrillation. B. Synchronized cardioversion. C. CPR. D. Transvenous pacing. Which of the following requires transcutaneous pacing preparation? A. Third-degree AV block. B. Mobitz type 2 second-degree AV block. C. Unstable sinus bradycardia. D. All of the above. Bradyarrhythmia is characterized by A. Any rhythm disorder with a heart rate less than 50 beats per minute. B. Any symptomatic rhythm disorder with a heart rate less than 50 beats per minute. C. Any rhythm disorder with a heart rate of less than 60 beats per minute. The demand rate for transcutaneous pacing ought to be set at A. Not exceeding 60 minutes. B. Started at 80 minutes and increased or decreased based on the clinical outcome. C. Began at 60 to 80 minutes and adjusted depending on the clinical outcome. Which of the subsequent statements is false? A. Second-degree AV block type 2 equals Mobitz I. B. Second-degree AV block type 1 equals Wenckebach. C. Complete block equals third-degree AV block. D. Wenckebach equals Mobitz I. There is symptomatic bradycardia when A. The symptoms are due to a slow heart rate. B. The heart rate is slow. C. The patient has symptoms. D. All of the above are needed for symptomatic bradycardia to exist. What degree of block is typically regarded as the most crucial and therapeutically significant? A. First-degree AV block. B. Third-degree AV block. C. Type I. D. Type 2. In what medications does the bradycardia algorithm involve? A. Atropine, norepinephrine, dopamine. B. Atropine, epinephrine, dopamine. C. Atropine, epinephrine, lidocaine. D. Atropine, lidocaine, adenosine. Acutely altered mental status, shock-like symptoms, and ischemic chest pain are all bradycardia symptoms. A. False. B. True. What is the Bradycardia algorithm's epinephrine infusion rate? A. 2 to 10 micrograms min. B. 2 to 5 micrograms min. C. 0.5 milligrams every 3 to 5 minutes. D. 1 milligram every 5 minutes. Hypotension and sudden heart failure are symptoms of symptomatic bradycardia. A. False. B. True. Which of the following should you evaluate according to the BLS survey? A. Airway, breathing, circulation, defibrillation. B. Airway, blood pressure, CPR, differential diagnosis. C. Responsiveness, activate EMS and get AED, circulation, defibrillation. D. Circulation, breathing, cardiac assessment, drugs. What doesn't constitute a fundamental airway skill? A. Head tilt chin lift maneuver. B. Placement of laryngeal mask airway. C. Jaw thrust maneuver without head extension. D. Bag mask ventilation. What would you do if a 79-year-old man was in SVT, had a blood pressure of 80/50, complained of chest pain, and wanted to pass out? A. Synchronized cardioversion. B. Lidocaine. C. Carotid massage. What type of suction catheter offers the most proficient oropharynx and heavy particulate matter suctioning? A. Pediatric soft flexible catheter. B. Laryngeal tube. C. Rigid catheter. Which of the following does not constitute an essential component of a dynamic resuscitation team? A. Closed-loop communication. B. Precise roles and obligations. C. Knowing one's own limitations. D. The team has multiple leaders. What would you do if you were transferring someone who had suffered a cardiac arrest and was unable to get them in for? A. Place a central line. B. Administer all medications through ET tube. C. Obtain intraosseous access. Which of the following is assessed as part of the ACLS survey? A. Airway, breathing, circulation, differential diagnosis. B. Airway, breathing, chest compressions, deformity. C. Airway, breathing, circulation, defibrillation. D. Airway, blood pressure, CPR, differential diagnosis. How long should ACLS practitioners keep interruptions to a minimum when performing chest compressions? A. 20 seconds. B. 10 seconds. C. 30 seconds. D. 60 seconds. What harm might hyperventilation cause? A. Increase intrathoracic pressure. B. Reduce the heart's venous return. C. Reduce cardiac output. D. All of the above. The QRS complex on an ECG stands for the following. A. AV valve closure. B. Septum relaxation. C. Ventricular contraction. D. Atrial contraction. Which of the following is not an example of advanced airways? A. Esophageal tracheal tube. B. Nasopharyngeal airway. C. Laryngeal mask airway. D. Endotracheal tube. Which of the following rhythms is most commonly present in the first minute following a cardiac arrest in adults? A. Ventricular tachycardia. B. Asystole. C. Bradycardia. D. Ventricular fibrillation. An 80-year-old patient presents with severe chest pain. Heart rate is 30 and blood pressure is 60 pm/Hg. The monitor shows sinus bradycardia. Which drug is indicated first? A. Lidocaine 75 mg for bolus. B. Isoproterenol infusion at 2 euro 10 mg min. C. Atropine 0.5 euro 1 mg for. You have been unsuccessful in the first 2 attempts to defibrillate an adult. The energy for the third defibrillation attempt is A. 50 J. B. 100 J. C. 200 euro 300 J. D. 360 J. For a deeply unconscious patient in shock, what is the airway of choice? A. Endotracheal tube. B. Esophageal obturator. C. Oropharyngeal. D. Nasopharyngeal. In an unconscious or semiconscious patient, an oropharyngeal airway. A. Eliminates the need for head positioning. B. Eliminates upper airway obstruction. C. Has no value once an endotracheal tube is inserted. D. May stimulate vomiting or laryngospasm. Dopamine at low doses will cause A. Elevated blood pressure. B. Renal vasoconstriction. C. Renal vasodilation. D. Tachycardia. Bradycardia not responding to atropine should be treated with isoproterenol 1 mg in 250 ml D5W infused wide open. A. True. B. False. Lidocaine enhances myocardial contractility. A. True. B. False. Beta blockers depress the pumping function of heart muscle. A. True. B. False. Anti-shock garments should be used to treat acute cardiogenic pulmonary edema. A. True. B. False. Ventricular fibrillation produces no cardiac output. A. True. B. False. A pop-off valve is desirable when selecting a bag valve mask device. A. False. B. True. Infectious complications of intravenous cannulas should be prevented by using systemic antibiotics. A. True. B. False. Verapamil should be used when the origin of a wide complex tachycardia is unknown. A. False. B. True. After providing a shock with an AED, you should A. Start CPR, beginning with chest compressions. B. Check a pulse. C. Give a rescue breath. D. Let the AED reanalyze the rhythm.